skull-base surgery from within the nose as a forehand technique in a cooperation with a neurosurgeon has come forward in the last 15 years or so. I would say that it is not a surgery which is probably expanding in all departments, because for that the numbers of patients are too low. And saying that, I think that the centers who should be allowed or should be trained people to do that type of surgery will be limiting themselves because of these numbers of patients. And you should have a certain number or amount of cases along a year in order to have a good experience with that. But said this, I would say that it was the most amazing advantage we have seen in the last decade with approaches formerly performed through external approaches, opening the head of the patients, and now this surgery and these tumors being approached from within the nose and being removed with the cooperation of the neurosurgeon, and then the reconstruction of the whole skull base. And when we started that initially at the anterior skull base, basically with CSF leaks, meningoencephalocele, now we are able to approach not only the full anterior skull base and going inside for example, meningiomas or esthesioneuroblastoma, that is malignant tumors infiltrating the whole skull base. But we went further and now are addressing the middle skull base and the posterior skull base as well in very particular cases. So I think that was a big development we have seen, which initially started, of course, with simple endoscopic sinus surgery.
The first quality of this surgery, of the endoscopic and the nasal surgery, is the visualization. So with this we try to understand where are located the different lesions, and we learn how to remove the polyps without affecting the mucosa. We understand how to deal with the CSF leakage, with the defect of the skull base. And this was a milestone. In the first 90s, surgeons learned how to repair the skull base defect with the endoscopic procedure, with the endonasal endoscopic procedure. Since then, we improve our ability to reconstruct the skull base. And this was the milestone to approach the tumor resection. So the endoscopic can approach tumor resection because with the visualization inside the nose, we can understand where are disease or not. Because the first goal of the surgery in tumor resection is to reach the clear margin resection, the free margin resection. So before the surgery, you have to program your way, and if it is possible through the nose only, okay, otherwise you need a multi-portal approach. So since that we learned how to repair the skull base, we was habilitated to resect the lesion. Otherwise we cannot resect the lesion if we don't know how to close the defect. And this was a very well successful journey. And nowadays we try to use not only the nose with the scope, but the additional port, like the orbit, the oral cavity, the transcranial. So nowadays endoscope it's only a tool for the multi-portal approach in skull-base surgery.